So we here today to learn the secrets of a healthy and happier life through the healthier and happier gut. And this is, as I mentioned in introduction, to the whole gut wellness program. So welcome to this little preview of the work of several months. So today I want to talk about this uh, program and introduce the importance of gut health, understand and teach you the burden of their gastrointestinal disorders in American medicine and how our lifestyle choices affect our gut health. Because this is really important. Everything we do will affect our gut health. So it's really a very important point for you to understand and remember. And I also would like to say a few words about whole gut wellness program. We kind of go over outline of this program. You'll see what you can learn through it, and we'll go over all the 5 dimensions that this program outlines. So, what is the gastrointestinal health? Many of you, of course, knows that this is their gastrointestinal tract is one of the most sophisticated system in our body, and the primary role of it, as we always thought, is the digestion and absorption of the nutrients. So, whatever we ingest, whatever we chew, swallow, whatever gets in our gut, either food or supplements or medicines or water, will be sending a signal to the rest of our body. Because if you think about it, this is the organ that helps us to communicate with the environment. So this is one of those barrier organs. Of course, we have skin that separates us from the environment outside of us, but also the gastrointestinal tract is the pipe, as you know, that goes all the way from the mouth to the rectum, and it's hollow inside. So whatever goes through that communicate to the rest of our body. So it's basically a really sophisticated and really important system for us to feel good, and one of the leading uh, factor for chronic illnesses and the future health. So, and of course, because this is a communication organ, it also communicates with the rest of our body, and it communicates with other systems. Things like the health of our skin. If you think about a variety of the skin disorders like acne or eczema or psoriasis or a variety of the rashes or allergic reactions on the skin, it is intimately related to our gut. Our endocrine system, here it's depicted in the form of thyroid, which is only one endocrine organ, also communicates with the gut. If we don't absorb sufficient amount of nutrients, our thyroid and other endocrine organs do not work properly. It also directly linked to our liver health, and liver, as you know, is the major detoxifying organ. So it helps us to get rid of whatever toxins either we produce internally or we expose ourselves through our environment. Of course, cardiometabolic health. It's been numerously shown now that the microbes in our gut will affect our cardiovascular outcome, the rate of heart attacks, their severity of their high cholesterol and good cholesterol, all can be affected through our gastrointestinal system. And of course, brain. Brain is so important and so heavily relates on the gut health. And many of you probably heard about expression leaky gut, leaky brain, which means that if the intestinal barriers in our gut, and we'll talk about it later, are broken, that leads to the broken blood-brain barrier. That is a protective barrier on the way to the brain, and that can create variety of the cognitive issues, mood disorders, psychiatric disorders, depression, obsessive compulsive disorder, even addiction can be heavily connected to the gut health. And the last but not the least, immune system. I think I probably should start with immune system because 70% of our immune system is located and laying inside of a gut. So, because immune system has to be in surveillance of whatever comes with the food, with the drink, with their supplement or medication. Immune system is there to taste and take a sample of it and say, okay, well, this is safe for us. We don't need to react. Or no, 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 this is the foe and this is the enemy. We want to get rid of it. So that's why immune system is probably one of the primary is system in the body that related to the gut. So why the gut matters? Of course, if our GI health is out of balance, I hope I proved my points that our overall health is compromised. So it is also what I noticed and observed from my patients. It is often the best place to start when to treat my patients because probably 50% of the symptoms in the most difficult cases can be addressed with a proper gut health. So if we can balance the microbiome in the gut, if we can heal the gut being inflamed or leaky, things just fall into place and body has this amazing self-regulating mechanisms. All we need to do is to really take care of the gut. And that's why it's so important. But also statistically, we know that gut symptoms or gastrointestinal disorder symptoms affect so many people, and much more than even heart disease or AIDS or cancer combined. And the number of the GI disorders will overcome that number. So, and 75% of Americans experience persistent, not just acute bug flu, not just acute food poisoning, but really consistent, persistent chronic gut symptoms. And no wonder we're the nation of chronic illnesses because if we're not addressing gut issues early or periodically in our life, we're aging faster, we develop metabolic issues, we are much more prone to the chronic inflammatory states and diseases. So the symptoms of the condition for chronic issues could be a variety. So it could be chronic illness, as I said, is number one. But if you look at the regular symptoms, it could be gas or bloating or diarrhea and constipation, of course, inflammatory bowel disease, acid reflux or heartburn. Variety of autoimmune disorders always have a link to their health. Remember, 70% of your immune system is laying in your gut. So if your gut is compromised, it leads to compromised immune system. Also, food sensitivities, frequent cold and flu, again, relations to the immune system. Also, the stress will affect their gastrointestinal symptoms. Many of us know the expression of, I felt it with my gut, and that's how the gut and brain connected, and how stress will affect our GI symptoms. As I mentioned earlier, variety of the mental health issues and mental symptoms and diseases can be strongly related to gut health, depression, anxiety, addiction. All of that can be also related to the nutritional deficiencies because remember, the gut's main function is digest and absorb those nutrients. So if we don't have enough healthy digestive power in the gut, we will be in a nutritional deficiency state. And then again, brain fog, cognitive decline, even diseases like Parkinson's disease and Alzheimer have a component of the gut health. Headaches strongly connected to the gut health, food sensitivities, fatigue, again, autoimmune disorders like Hashimoto, and skin conditions like eczema, acne, and rosacea, all strongly related to the gut health. So the gut conditions are next to the common cold and most common reason for people to seek medical advice and turn to over-the-counter medication. Sometimes this over-the-counter short-term treatment become a part of life for many people, and it further deteriorates people's health. So this program is really to teach people that they don't have to rely on medications and can get better with just this program. So many of those people who complain of the gastrointestinal symptoms will go to their doctors, will go to the specialist gastroenterologist and undergo extensive testing and treatments. But unfortunately, get very limited answers or advice how they can improve and how can they be in charge of controlling those symptoms. And now it's time for us to really look at their lifestyle choices and how they influence the health. The quality of GI health is highly influenced by how we eat, how we sleep, and how we move. So those are probably one of the three most important things, three pillars of health. So all of that will be really in the program that I'm about to present will be digested and presented to you. What is the best steps you need to take so you can have a healthier life and healthier gut. And unfortunately, our modern life and our standard American diet that is filled with the processed food, with the chemicals, with the toxins, and also lifestyle choices like drinking alcohol or smoking tobacco or other substances, eating too much sugar, and drinking too much caffeine, and of course, battling with stress day in and day out will all predispose us to our unhealthy gut and chronic illnesses. So, and this is the time when I would love to teach my patients, teach everyone in the world who is interested about the whole gut wellness program. It will be educational tool to understand the GI tract and its intricate connections with the rest of the body from the functional medicine standpoint. And as you probably know, functional medicine has a little bit different understanding of treatment and trigger of the disease. It's far beyond here's the drug for your symptoms and call me in the morning. It's much more involvement, partnership with the patient, and education and understanding. So our consumers are definitely very much educated and motivated and well read, and they understand the importance of taking care and taking a charge of your health versus relying on someone to give you a pill. And then, of course, this program will be focusing on the balanced gut health and therefore balanced well-being and healthier and happier life. So we're going to talk about macronutrients and how they affect their gut health. Of course, carbohydrates, which will include sugars and dietary fiber. As you probably know, there's a complex and simple carbohydrates that are processed in the body and turned into the glucose. But we use this glucose to utilize for the energy production. But how quickly these carbohydrates are broken down in our gut will determine the effect. Those carbohydrates that take time to release the glucose to the bloodstream are much healthier versus those that go straight to our bloodstream and increase the glucose level up right away. And of course, fibers. This is our beautiful brews and garbage collectors that help us also to increase satiety, the feeling of satisfaction from the meal, feeling fullness, and that can aid with a healthy weight management. So that definitely should be a big part of your daily plate. Sugar that provides energies, but excess sugar can be definitely detrimental to your health and cause insulin resistance, diabetes or prediabetes, and cause chronic illnesses. And some other major macronutrients that affect our gut health and sustains our gut in a healthy state are the proteins. Of course, as you know, the proteins function as the foundation of the bones and muscles and skin and cartilage and even blood. They also play a really important role in building enzymes without which we cannot really digest our food. We cannot produce particles that are affecting our brain and affecting our hormones and hormonal level. Of course, and also some of the vitamins. So proteins are extremely important, and that's why sufficient amount of clean protein, and we'll talk about what is clean and what is not clean in this program. And then, of course, fats. Fats had a bad rap for many, many years, unfortunately, but fats are essential. Our brain is 90% made of fat. So we need a good fat in our diet. It's really, really important. And it's important to keep the fat in the optimal level. It's definitely healthy fat like fish oil or omega-3 fatty acids reduces inflammation and supports our brain health and mood stabilization, and also can reduce the heart disease risk. So not all fats made equally, as you know, and some fats are very important for our well-being and optimal health. And we're going to talk more about Mediterranean diet, of course, in the form of pyramid. As you can see, the bottom of this pyramid is vegetables. And then as we go closer to the tip of this pyramid, we reduce the amount of grains, including the breads, fruit, because the fruit are filled with sugar. So small amount of legumes and fruit, olive oil and nuts, yogurt and dairy, cheeses, then fish oil, fish and seafood, eggs, sweets, and then finally red meat. We're going to talk more and more about this longevity diet. And then, of course, we're going to talk about 4R approach to managing the gut health. During this program, you'll be able to actually start your own 4R program, which many of us need to do periodically. My teachers would tell me that everyone who cares about their health and wants to stay healthy should do this 4R program on a regular basis. How regularly? Maybe once a year or maybe twice a year. It all depends on where you start and how your symptoms progressing. Some people would need it more frequently, especially if they're exposed to antibiotics or some toxins. So this is a really important self-leading tool that you can learn through this program. And so the program will include discussion of 5 dimensions of GI health. The first part is, or first dimension is there. We're going to dive into the digestion and absorption function of the gut. In the second dimension, we'll talk about elimination and detoxification, where liver and other excreting organs take an important part in our gut health. The third dimension is definitely one of their important, and it involves microbiome balance. Barrier function is dimension number 4, and of course, gut and brain health. So briefly, we'll just touch upon what is dimension number 1. It's a dimension of the digestion and absorption. This is where we start engaging our gut with their communication with our external environment. Think about it, that our gut work continuously to digest and absorb nutrients from the food that you eat. And it does it even when you sleep. So that's why what you put into your mouth is so important, because this is the message that will communicate with the rest of the body. And this message could be either promoting health or detracting health. So then we're going to talk about the importance of digestive enzymes and the mechanical movement of their food through their gastrointestinal tract and how it affects our health. And the second dimension is probably one of my favorite because it involves their liver and elimination function. So elimination is equally crucial to our health as digestion. Think about it. If you put the food in your mouth and you swallow it and it goes to your gut, gastrointestinal tract, and your gut is doing tremendous job by extracting the nutrients and vitamins from all that food that you eat. And then you have to eliminate whatever the waste product is left from that, right? Also, our gastrointestinal tract receives the input from the liver through the bile excretion, and we're going to talk more about this in detail. So bile carries out tons of the toxins that our blood is exposed to. So all of that toxic waste needs to be eliminated with the bowel movements. And that's where the fiber becomes so important. And microbial balance, of course, is one of the most important in the gut health. I mean, all these dimensions are so important, but you cannot go without mentioning it. As you probably heard from many different sources, the microscopic organisms that live in our on our body and specifically in our gut is 3 times higher than our own cells. And it involves bacteria, yeast, fungi, and even parasites. And believe it or not, some parasites are very beneficial for us when others are just detracting from our health and actually eating our nutrients. So microbiome is one of the most active system in the body, and it affects not only the gut function, but also blood sugar regulation, cardiovascular health, and vitamin production. So this is extremely important to keep our gut microbiome healthy, happy, and give it the right nutrients and to avoid detrimental triggers like antibiotics that can wipe off a half of your beneficial bacteria and make their yeast and other pathogens to overgrow and also create problem like insulin resistance. Actually, some studies show that if you take a course of antibiotics, it affects your microbiome, or I should say damages your microbiome to the degree that you can be insulin resistant and have a higher chance to develop diabetes up to 2 years. And our practitioners still continue to prescribe antibiotics like it's a candy in the store. And unfortunately, they even forget to give people probiotics that can be probably mitigate their negative effect of antibiotics. I'm not against antibiotics. When you need them, you take them. But please, we're going to teach you how you can protect your microbiome, this really living microorganism that is there to assist you, not to detract from your health. But if we take antibiotics, if we eat the wrong food, we actually diminish the power of that microbial system that is meant to work for us. And then the fourth barrier is the barrier, fourth dimension is the dimension of barrier function. As I mentioned, the gut is selectively permeable barrier that permits the absorption of nutrients into the bloodstream while simultaneously stop all the negative and harmful impulses and substances that we encounter. That includes the bacteria, that includes their substances that are produced as the bacteria leave and a product of their metabolism. And because the gut is constantly exposed to the food, microorganisms from the food that or the microorganisms that live in the lumen of our gut, chemicals and toxins that come with the food. Think about all the pesticides and herbicides and glyphosate that you probably many of you heard before that comes with the conventionally grown food. All of that is there, and our gut barrier is supposed to protect us from all those harmful substances to enter our bloodstream. I forgot to mention plastics, and you probably see more and more reports about how significant the plastic effect on our health. I think recently we are posting the article in the social media. Please keep an eye on that about the top food that are contaminated with plastics, and that's your salt. It's actually, believe it or not, apples, carrots. I mean, things that we would never think that can have a contamination with plastics are there. And if you have a strong barrier function in your gut, guess what? All of that stays in the lumen of the gastrointestinal tract. And if you have a regular bowel movement, you are effectively eliminating all that exposure. Our body is such a sophisticated system, so we need to support it to do a proper job. So make sure you learn about how you can keep your barrier function healthy and supported. And then, of course, dimension number 5, this long known connection, actually a bi-directional connection between brain and the gut. And it's been known actually to conventional medicine doctors since 2009. That's when the first article about bidirectional connection of gut and brain appeared in the journal Gastroenterology. Well, guess I don't think many gastroenterologists do teach their patients about that, but my job is actually bring this information to you So you understand that exposure to stress can result in the changes in the gut and brain function. And our lifestyle choices, again, lack of activities, sitting at the computer or at the desk or in front of TV all day, lack of sleep, lack of regular eating may all lead to the imbalance of the gut function and the brain function. So gut imbalance causes brain dysfunction, and here we go. Now we have the epidemic of the mental health illnesses more than any other countries in the world. So many people are suffering from uncontrolled anxiety, from depression. I think this is one of the most commonly prescribed medication, SSRIs, for the depression. And look, we are the probably richest country in the world, and so many people suffer. So my job is to deliver this message. So maybe some people will start asking, okay, well, what can I do? And this whole gut wellness program will definitely help you to address those questions and learn and be smarter than some of your doctors to navigate your own health. Because if we don't take our health in our own hands, if we're not going to become partners with our physicians or with our healthcare practitioners, we are really not going to succeed or stop this epidemic of chronic illness. So, because you are here and you have a first exposure to introduction of whole gut wellness program, you have a special offer. So, if you take a QR code and scan um, this QR code, you will get an alert about this when this program will be launched. You'll get a special offer. And so, if you're interested to learn more about gut health wellness, and if you're new to this realm of functional medicine, feel free to take this GI health survey that you can also download by scanning this QR code and contact our office. Speak with my front desk person or any of our clinical consultants. Get on the discovery call or just follow my social media links. We try to publish only meaningful information that is worth your attention. And you can just also read some blogs on my website. And so definitely let us know if we can answer any of your questions or if you want to talk to one of my staff members. And for those who are on the call and you are my patient, you know that we are heavily relying on knowledge of the blueprint of our patients, the DNA of our patients, because it helps us to predict and prevent chronic illnesses. So if you are our client and if you had the 3x4 genetic test done, remember we have monthly groups. It's usually the last Monday of each month. During the lunchtime, you can attend for free with your test results and ask specific questions about this test and about the results of your test. And of course, we are still open for the new patients. Remember, friends want friends to go to the best doctors. So if you feel that any of your friends can benefit from this approach of the root cause approach, please refer them to us. We'll be happy to meet with them and talk to them. Also, because of you here today, I want to thank you for being a part of this presentation. Please take advantage of the 10% off on my e-store by using the code July 10 Q&A.